patients, Michelle, and we're going to be performing nasal specific technique with her today. And I'm just going to ask Michelle real quick about her symptoms and how we got to this point. So Michelle, tell us a little bit about the history with your sinuses.
Well, I had been experiencing nasal stuffiness, and it's not anything that would have been with allergies, and it's been going on for quite some time. So we did a thermography, and it showed that my nasal passages through here were definitely inflamed and swelling, and they needed to be attended to. Dr. Ray here went ahead and he did some nasal drainages, and now we're at the point where we can go ahead and insert a balloon. When he did the nasal drainages, I felt a lot of relief, and it even stopped my snoring, which was a good thing. Oh.
Excellent. So she mentioned a thermography. That was a report that we had from a thermographer who comes to the office, and she not only does breast thermography, but she does the full body, and that's how we were able to detect the changes that she was having with her sinuses. We also noticed on physical exam that inside of her nasal passages it was very swollen, and that was leading to the stuffiness. Okay, so now that we have helped with some of the inflammation, we're going to move on to the next part of the process, which is getting the passages to actually open up to allow air to come in a little better. So what we're going to be doing is called nasal specific technique. I'm actually going to be inserting a balloon into each of the 3 passageways in your sinuses, clamping your nose down, and then blowing the balloon up. Alright, so I'm going to go ahead and help you lay down right here. I'm just going to put my gloves on, and I'm going to give you one of these. This one I want you to keep in your right hand. Alright, and this one I want you to keep in your left hand. And remember that one of these is going to be for tears. As we blow the balloons up, you're going to get a little bit of a response, like when you pluck a nose hair, your eyes water a little. And then the other side as well too, because we're going to be going in and out of the nose. You may feel a little uncomfortable, like you want to wipe your nose. So that's why you have 2 separate ones, okay? Just remember, one's for tears and one's for boogers, and don't mix them up. If for some reason you feel extremely uncomfortable, don't say stop or yell or anything like that, or try to inhale or anything. Just lift up a hand, and I'm just going to come right out of there, okay? If I see one of your hands come up, I'm stopping the process. All right, and remember, if you feel the balloon get stuck and I say open your mouth, again, just nice and calmly, open up, I'll pop the balloon and it'll come right out, okay?
No worries. Thank you.
All right, and we're going to take, this is the balloon that we're going to be filling up in there, okay? Perfect. All right, and we are ready to go. All right, so I'm going to have you tilt your head back just a bit, turn towards me just a little bit, perfect. And we're going to start just by guiding this in nice and gentle. Okay, again, if you feel any issues, just raise that hand up and I'm out of there, okay?
Okay.
This is usually the easiest sinus passageway to get into, the one up on the top here. So again, you may feel a little bit of discomfort as we kind of work our way in there, but it shouldn't be bad. All right, you ready? Here we go on the first one. There we go. Remember, during this process, you may feel some cracking or some different things moving inside of your nose. That's completely normal, okay?
Okay. Oh, yeah.
I felt that one crack a little bit on you.
I did.
Okay, you felt that movement in there?
I did.
Okay, perfect.
Okay, now I know what to expect.
Now you know what to feel, right? So remember, the top one generally doesn't have as much inflammation as the middle 2. Okay, so now we're going to go to the bottom. And you can see on the video here that I'm using a little bit of a different angle for each one of the different sinus passages. And we're going to do a quick little test here as soon as we're done with this third one. Okay, relax. Felt something move in that one too. Okay, good stuff. Okay, now I want you to wipe your nose down a little bit. All right, and I want you to hold your left sinus, the one that we just did, I want you to hold that one shut and breathe through the right side. Go ahead. Good. All right, now hold the other one shut and breathe through the side that we just did.
I can breathe a lot better.
You can feel a big difference there between side to side,
yes,
right?
I can.
That's half of the nasal specific technique. You can see that's the process, and we're just going to repeat that on the other side. Thanks so much for volunteering, Michelle.